The Better Practice Series Introduction to Evaluation webinar, presented by me, Sianne Hodge, Program Manager at NADA, and Dr. Rose Miller, our Data and Research Manager. I'd like to acknowledge the Gadigal people of the Eora Nation as the traditional custodians of the lands upon which our office stands. We extend this acknowledgement to all Aboriginal and Torres Strait Islander people across Australia and pay our respects to elders past, present and future. I'd also like to extend that respect to any Aboriginal people who are dialing in today. So today, the webinar will be presented by myself. I'm the Program Manager at NADA. I've been working at NADA since 2015, and project managing the Program Evaluation Guide was one of my first projects. At the close of the webinar, we'll be joined by Dr. Rose Miller, our Research and Data Management Officer, and she'll be answering the question and answer part of the webinar to go through what are the key challenges that members might face when undertaking an evaluation. By the end of this webinar, you will be able to identify why evaluating programs is important, describe and distinguish between different types of evaluation, discuss how a logic model fits in evaluation, and identify where to find evaluation resources and adapt these for your organisation, for your team, and for yourself. Just a bit of housekeeping before we get started. Today's webinar is being recorded and we'll be emailing you a link to the recording along with the slides and handouts following the webinar. Please submit your questions anytime into the question box throughout the webinar for Rose to answer at the close of the webinar. We'd also like to remind you, we'd love to know what you think of today's webinar by completing a short evaluation survey, which we'll be sending you after the event.
So let's kick off with key definitions and concepts. What do we mean by evaluation? Evaluation is the objective assessment of a program or project's design, implementation, and results. It uses a structured process to find out whether a program works as intended and how well a program works to facilitate change for clients. It's an integral part of planning projects, programs, and services. Evaluation as an area of practice tends to be laden with confusing jargon. However, whatever terms are used, it's useful to remember that evaluation primarily involves these activities: describing the program being run, the treatment model, and the characteristics of participants, counting numbers of people, counselling sessions, training, information workshops, etc., recording inputs and outputs, client outcome measures, and client and stakeholder feedback, measuring the differences in before and after scores and follow-up scores if possible, and acting on this information by communicating and using findings to drive service improvement. So why evaluate AOD programs? Knowing that our work makes a difference is essential for us as a sector. Evaluation provides the means to assess the impact of AOD programs and identify where they can be improved to increase quality and effectiveness. Evaluation findings are needed to report to stakeholders and funding bodies for reporting, for benchmarking, and to apply for funding. They also form an important engagement tool to be used with clients and staff, providing tangible evidence of a program's value and the impact of participation. In an environment where programs must demonstrate an evidence base and continuous quality improvement is the norm, evaluation is now an expectation for AOD organisations. There are a number of different types of evaluation that can be selected depending on the purpose and phase of a program and the focus of evaluation. Now, summarised quite neatly in this table here from the University of Michigan is a table on the types of evaluation to conduct and when. So let's take a look at each evaluation type, when it's conducted, what it shows, and examples of questions asked. Let's start with the needs assessment. So a needs assessment is undertaken prior to a program being designed and delivered, and it examined the perceived want or need among a target population to judge whether a program is necessary in a specific context. An example of questions asked as part of a needs assessment includes: to what extent are the needs of the target group being met, and what can be done to address this? The next is a process evaluation. And so a needs assessment and process evaluation both sit on the more formative end of the evaluation spectrum. So we think formative, forming the program. Now, process evaluation is undertaken during implementation, and it examines whether program activities have been undertaken as planned and helps to identify where improvements can be made. So some examples of questions that are asked as part of a process evaluation include, is the program being implemented as planned? Is the program reaching the target group? If not, why? And are program participants satisfied with the program? The next is outcome evaluation. Outcome evaluation is undertaken at program end, and it examines the effectiveness of a program in facilitating change for the client group as indicated by changes in client outcome measures. An example of a question that's asked as part of an outcome evaluation includes, to what extent are program objectives being achieved? Finally, a key evaluation type is impact evaluation. Impact evaluation is undertaken at least a year after program end, ideally 3 to 5, and it's not usually feasible for AOD programs to conduct. And it examines the overall impact of an intervention on a population. A question that is usually asked as part of an impact evaluation is, what impact, both positive and negative, intended and unintended, has the program produced, for who and under what circumstances? So now I'm going to give you an overview of program logic. What is it, and how can it be used when developing and evaluating AOD programs? A program logic is a commonly used planning, evaluation, and review tool. It shows the intended outcome of a program and how the program is theorized to facilitate change for clients, i.e. the logic of, if we do this program with these clients and these inputs and outputs, we can expect to get these outcomes. Developing a program logic is a highly useful exercise to undertake before embarking on an evaluation, as it provides a really good snapshot of how a program works and enables staff to clearly articulate what the program is aiming to achieve and why it is logical to expect such outcomes. In its simplest form, a logic model looks like this. It's a graphical representation that shows the logical relationships between the resources that go into a program, the inputs, the activities the program undertakes, the outputs, and the changes or benefits that result in the short, medium, and longer term, i.e. the outcomes and impact. Now, we actually use a logic model in everyday life. Think about being hungry. What does that feel like? What do you need to do? Probably what you're wanting to do is get some type of food. Then you're wanting to spend some time, money, and effort finding that food. You need to then prepare and eat that food. And then in doing so, hopefully you will be feeling satisfied and better. So why develop a program logic for an AOD program? Well, there are several ways in which a program logic can support actions throughout the program planning, implementation, and evaluation cycle. At the planning phase, a program logic can help determine what to evaluate, not just the intended outcomes or impact of a program, but also the aspects of program implementation that are critical to a program being successful. Developing a program logic can also assist in identifying key evaluation questions and refining them so that they're more specific. It can help, for example, convert a very broad question like, was the program effective, into a more specific question like, how effective was the program in helping smokers to initiate quit attempts, for example. And by helping to identify questions, it's also helping to identify the information needed to answer those questions, and in turn help decide when to collect that information. Lastly, a program logic can provide a mechanism for ensuring acceptability among stakeholders. It can help to ensure that stakeholders' views concerning specific issues are kept in perspective in an evaluation by clarifying how these views relate to the overall program. So what should you include in a program logic? Well, there are lots of versions, but the example that I've included here is taken from a research evaluation framework from Western Australia. from the Chronic Disease Prevention Directorate at the Department of Health there. And so the key components that I've included in this example are the situation, which illustrates the environment in which the problem or issue exists, and in which situation in WA is that there's a high prevalence of smokers. Smoking is a leading cause of disease burden, and it's costing the WA economy a substantial figure in healthcare costs and lost labour. The following component is the inputs. So the inputs are the resources that are invested in the program that allow us to achieve the desired outputs. So here, the inputs are listed as the staffing, the funding, and the partnerships. And these are dependent on achieving the outputs, which are the activities conducted or the goods or services created to reach the target group. And so here, the media campaign, developing and distributing resources and delivering the information and training session is dependent on having that staffing, that funding and partnerships. And so you can see how this causal chain is starting to develop from left to right. The outcomes are the changes or benefits for individuals, families, communities, etc. So here I've just condensed it into the short and medium term outcomes in one box, and then the longer term impact into a separate box, just to see how one connects to the other. So by running the state campaign and developing and distributing these resources, developing and delivering the information training sessions to various stakeholders, that is theorizing that that is going to lead to increased awareness of smoking related harm, which then in turn creates increased motivation to quit and increased quit attempts. And the overall impact of that is reduced prevalence of tobacco smoking in WA adults. Others also include additional components such as assumptions, which are the beliefs about the program and the people involved and the way we think the program will work, as well as external factors, which are the influences on the program's success. So how does this all relate to the evaluation plan? So the Centre for Epidemiology and Evidence at the New South Ministry of Health have a great evaluation guide, which I've taken this table from. And that just shows the connection between the program components, the program logic model components, and the evaluation plan components. So here in this table, it shows quite clearly that the aims correspond to the impacts, which are measured by an impact evaluation. The objectives correspond to the outcomes, which are measured by outcome evaluation, and the activities or the strategies correspond to the inputs, activities, outputs, which is measured by process evaluation. Which now brings me to a template that NADA developed as part of its face-to-face evaluation training, which we're hoping to run in the new financial year. And so all it is a Excel spreadsheet that consists of 3 tabs that combined make up a monitoring and evaluation framework for an AOD program. The first tab being a program logic template, the second tab being the evaluation plan template, and the third tab being the evaluation report template. So let's just have a look at each of those tabs and how they work. So the program logic tab here, as you can see, it includes the components that I illustrated in that earlier example, the inputs, the outputs, and the outcomes through to impact. Also, on that bottom row there, it's including the type of evaluation that they correspond to. So how I've set this up is I've included prompts. So when you hover over the red triangles, you will see some prompting of what that field is about and what to consider. So there's an example for a prompt for activities, as well as process evaluation. So if you forget, along the way as you're inputting the information, just hover and you'll be provided with that advice. So for example, it's given some example questions that are usually asked as part of a process evaluation. The other thing that I've set up in the template is for information to be automatically copy and pasted into relevant fields across the 3 tabs. So if you input the activities, the short-term, intermediate term, and long-term outcomes here, they will automatically transfer into the evaluation plan. So it reduces that administrative burden, and all you have to start thinking about here is, well, what indicators are you going to use, and where are you going to get that information to start measuring whether your objectives and aims and activities are being achieved as intended. And again, if you hover over the red triangle, you'll be provided with that advice. So here is the prompt for what to consider when selecting outcome indicators. And again, once you start inputting that information, it will transfer over to the evaluation report. So all you have to do here is start entering in the numbers, and you've got a complete snapshot of your evaluation plan and how your program is tracking, and whether the aims, objectives, and strategies are being achieved as planned. Now you notice here that there's a few columns here to enable some benchmarking, that if you do have that baseline data and you do have some targets, you can enter it there. If you don't want to enter that information, just leave it blank or delete the columns, and that's the same across the 3 tabs. And that brings me to the end of my presentation. I hope I've been able to demystify some of the key terms and processes of evaluation for you. And I hope that I've shown that evaluation doesn't have to be complicated, it's just systematic. And while overwhelming at times, the jargon is actually incredibly useful, as it provides a common language and shared understanding of the program being evaluated, and the why, the when, the how, and the who's going to do it. And so to close, evaluation processes, especially the step of developing a program logic, is an essential and worthwhile investment. It can help save you time, money, and energy by showing you what is working well or not, and identify ways to improve to better meet the needs of clients and the communities we serve. Now, if you're looking for further information, there are lots of resources out there. This webinar and our face-to-face training is based on our program evaluation guide. Excuse me. The Community Mental Health Drug and Alcohol Research Network also have some fantastic resources, including a mentoring program and ethics committee to peer review projects. Australian Evaluation Society has some great guides as well. Social Impact Measurement Toolbox from UTS has some fantastic online courses and templates, and Better Evaluation just is a really fantastic website that can walk you through all steps of evaluation. And of course, if you need help from us, please reach out. But yeah, that brings me to the end of my presentation, and we'll now move on to questions.
So I'd now like to hand over to Dr. Rose Miller. Rose, if you wouldn't mind telling members a little bit about yourself.
Thanks, Sianne. My name is Dr. Rose Miller, and I work with NADA as their Research and Data Management Officer. Before I started working at NADA, I actually ran an outcomes program evaluation with the Drug and Alcohol Service. I've also taught at the university level. I'm actually an honorary lecturer with the University of Newcastle, and as part of that role, before I started with NADA, I actually taught program evaluation information at the master's level. So where my expertise lies is in implementing an evaluation. So while I'm going through the next few slides, I'm just going to talk about some common questions about evaluation and the challenges you face when you're trying to evaluate a program. But while I'm doing that, please feel free to submit questions. And when I get to the end of my talk about poor data quality, resource constraints, and staying on track with your evaluation, I'll address those questions. So one of the first big challenges with conducting an evaluation is definitely poor data quality. Now, there are several reasons for this. And one of the main reasons is that when you're working with a drug and alcohol service or any kind of service, you're dealing with real data and real people. Unfortunately, when you are dealing with live people, you don't have the luxury of being in a lab where you can control all the different factors and things like that. And so it's just like it's a side effect of doing an evaluation with in a real environment. And so why I'm emphasizing that is that a lot of times when you conduct an evaluation, you're going to be using research methods, or you might be consulting with a researcher or someone who has experience with evaluation. And sometimes when you conduct research or evaluation, it might be in environments that are a bit more controlled. So you kind of know who you're following, whereas in a drug and alcohol service, a lot of times programs are already established. So you've got to kind of think about some of the challenges and kind of risk manage that. So with poor data quality, what I found the most helpful was just kind of thinking about making sure that your data collection is accurate and monitoring it. So I know when I was working with a program, what we did was we came up with a weekly process to check in. So for instance, the data was being collected as part of the client engaging in treatment. And so I would need to liaise with a lot of different stuff to kind of make sure that that all happened in the way that we intended. And what you might find is that if you are working with, say, an external evaluator, there might be a little bit of negotiation, because a lot of times what would be ideal in terms of when you collect data versus what you can actually achieve when you are working with someone in a service environment, they're not always going to match up. So, but I can tell you from experience, you can come to a happy medium. And a lot of times it's just understanding what the type of data that's being collected and some of the constraints that will be on the analysis of the data later on. Basically, the more accurate and thorough you can make the data collection while it's happening, the better. And also with incentives. So that can be really useful. Now, if it is being conducted, your evaluation as a research project, and in fact, any evaluation, you do need to consider the ethical implications of this. So if it is a formal research project, you'll need to get ethical clearance. And so if you're working with a university, they can kind of guide you through that process. And also ComDown has a lot of, I guess, resources to help you through that process. But when I talk about ethics, I'm not talking about kind of, going through all the ethical principles and kind of things that are out of touch with reality. I'm talking something as simple as that when, say, you're talking to a client or someone participating in a service, that you've got the consent to use their data in your evaluation. So there's a lot of different methods for consent. You've got informed consent. That just means that the person is aware of what their data will be used for. Or there's, if you have an existing database or like you have collected data over the years, sometimes there's other methods of consent, so using the data you already have. So it's just something to consider in the planning stages, and that you might need to factor this in. Just so I did see that there was a question relating to this. So can you use existing data to run an evaluation? And definitely, in fact, it's highly recommended. And I'll just go on to my next slide because this links in with that. So resource constraints. So if you're going to conduct an evaluation, I actually would start small, and not because while you do want the most bang for your buck with running an evaluation, starting small can actually help you to kind of identify obstacles and barriers that are going along as you're conducting the evaluation. In my example, when I worked on an outcomes evaluation, it actually, at the end, it actually became more of a process outcomes evaluation. And the reason was that it was the first evaluation conducted with that service. And so in the while conducting the evaluation, we actually found there was a need for a bit of a semi-process evaluation at the same time. So sometimes you are going to come across things that, particularly if it's the first one of its kind, you just need to be a little bit flexible and kind of plan ahead a bit. But what I would emphasize is, start small, and also teamwork is incredibly important. Another thing with resource constraints is that something like, for instance, with the program logic, that can kind of help you to get an idea of what your program does and what you should be measuring. And that's really important for figuring out what you're actually going to need to conduct the evaluation. So sometimes things like developing a program logic, thinking about what resources are actually available, what funding, what people, how much time is going to be needed to kind of maintain and manage your data collection or coordinate data collection. It's good to think about these things up front because it can help you plan it and make sure that it's done in a way that's not going to impede in the operation of your service. Because at the end of the day, that's what we're here for. We're here to work in our services and provide top quality care to our clients. So if you can plan ahead a little bit, it really helps to be able to conduct the evaluation, but not let it impede the day-to-day operations of your service. So there's some benefits and challenges to conducting an evaluation internally or externally. Now, with these ones that we have on the screen, which is from Ali Ward 2005, the one that I was involved in, the outcomes evaluation, was actually a combined one, and I would highly recommend that. It can be challenging because, so I'll do some examples. So I was basically working for as an external evaluator, but I was on site with the drug and alcohol service. And so the benefit of doing a combined approach is that you get the benefits of the internal. So for instance, you kind of know how the program works, you get insider knowledge, and you also are more looking to do it in a collaborative way. However, one of the challenges of an internal evaluation is that, of course, it can be difficult to be objective. And when you're working really closely with the service and you kind of are really invested in it, sometimes being a bit too close to it can actually hinder conducting an evaluation. So I would, an external evaluation can make it a bit easier to be objective, but then you've got the reverse. The challenge is that sometimes if you bring someone in externally, because they're not going to know how the program works, or you know what, they might not even, they may have expertise in evaluation, but not necessarily understand how it works in drug and alcohol services or the sector. So while you've got that objectivity, it can be a bit hard to kind of translate things for them. So my recommendation would be, if you can, do something that's more combined, and there's a few different ways you can do that. So when we run face-to-face workshops on these, what we're doing in the webinar series at the moment, we can go through some of those methods and ways you could do that. And the final thing I wanted to go over that I often get a lot of questions about is how to stay on track, because this can be quite challenging. And really, the way to stay on track with an evaluation is what I've talked about just before. So with addressing poor data quality and resource constraints. So if you've got a plan and you kind of know how you're going to tackle these things ahead of time, it makes it easy when something unexpected come up. And trust me, something unexpected will come up, guaranteed. What can also help is implementing some basic project management strategies. So I know when I was conducting the evaluation, so I wasn't just thinking of the broad picture of the 2 to 3 years that I was involved in the evaluation. I was thinking long term, but I was also thinking on a week-to-week basis. So I was thinking about what things need to be checked each week. Do I need to follow up with anyone? Do I need to contact this person? If this thing is happening in 6 months' time, when do I need to start planning that? And so one of the things that can really help is to just make sure you've got someone available, whether you need to hire a research assistant, or let's say maybe a staff member needs to allocate some of their time to the evaluation. It's just good to think about those kinds of things, because if you kind of decide that a bit ahead of time, then if any surprises come up, you're in a better position to be adaptable. And I know of those of you who work with drug and alcohol services, you are adaptable. So if you kind of just bring that kind of mindset to evaluation, if you're involved in one, that'll really help in the long run. Okay, so thank you for watching, but we're going to go do some questions now. So I will just bring up the Q&A. Okay, so the first question I've got here, which I referenced while I'm talking, was can we use existing data to evaluate our program? And yes, you definitely can. I actually recommend it, particularly if it's the first evaluation you're running. Another thing I would suggest though is that, so if you're kind of being thorough with your planning, so it's things like, do you need to apply for external funding? Do you need, say, a staff member or an external evaluator? Like, if you think about those things, then you've got a better idea, and of course, develop the program logic, then you've got an idea if you do need to collect extra data, you just want to be a bit strategic in that. So I know that with the one that I conducted the evaluation, we did collect some additional data, and I can tell you it can be a bit challenging because say in a normal research project, because you've got like a dedicated researcher or RA, which is research assistant, working on it or monitoring it. That's all they do. And so they're kind of coordinating anything. Whereas with an evaluation, even if you've got a dedicated researcher or evaluator, they're often doing other things. So they're kind of talking to stakeholders, they're kind of managing things, like they're doing other things. So I would maybe estimate like a quarter of the time you would for data collection for any new measures or data compared to say an average research project. So it's not that I would definitely encourage you to collect additional data if you feel like that's necessary. Just kind of think about that, the workload and the time it's going to take, and be strategic in what you choose. And definitely for like a first go at this, I would focus on data that you're already collecting as part of your normal day-to-day service delivery. Okay, so another question is, how can we evaluate changes made during COVID? That's a great question, and it's in fact something that we've gotten. So I also work with NADA-based support, and that is a question that we've received, particularly in relation to NADA-based. So I work in NADA-based quite a lot as well, the data there. In fact, some of you may already know me from emails. So evaluating change during COVID, it would actually work the same as a normal evaluation. It's just that COVID was unique in that it was a real life event. So you can definitely use, say, your own data management systems or your NADA-based data. What I would suggest is that, so to perform an evaluation that's specific to a moment in time, you've just got to think about what dates did it happen and how you want to quantify it. So for instance, with COVID, if you want to check the impact on it on, say, service delivery, for instance, you would need to kind of say, well, when did COVID, the pandemic, have the most impact on, say, clients or people entering the service? You pick a date, and then you'd probably need to pick another date and time where COVID wouldn't have been impacting, say, service delivery. So you could say do a pre and post, like retrospectively. That just means that, say, if you want to pick 2020 April to June, you would want to pick 3 months before that, like prior to that time period, to compare any differences. So basically the question is that how many ways are there to skin a cat? It's saying with evaluating changes during COVID. It's really just thinking about what is it that you want to evaluate during the COVID period, and figuring out ways that you can do that that's kind of more objective. And so the method I just outlined, which is comparing the COVID time period versus a previous time. And also you could actually do it so that the COVID period is compared to, say, data from this year. You could do it that way. And there are a few functions in NADA-based that can use for this. And also if you're doing this as well, something like the data quality report, functions that are available in NADA-based can be really useful because when you're picking data from a certain time period, it can be helpful to see when, say, for instance, if you've got duplicate data, which just means like doubles, you can go back and correct them in your system. And also, I just want to note here, the challenge with data quality with evaluations, and why I emphasize that you're probably going to run into these, is that a lot of services use what we call databases, and databases just tend to need maintenance over time. And so a lot of times when you're running a project where you collect data, you have a lot of control over what data goes in to the database and maintenance. Whereas if you're kind of dealing with, say, a services database that is having, like, doing a lot of different functions, you don't always have that level of control. So that's just, data quality is just a normal part of evaluation. And definitely don't be disappointed if you do find that there is some maintenance you need to do, because it literally is just a normal part, and it's just the impact of working in a service or a database that is being used on an ongoing basis. Okay, and the last question I've got here is, How much data do I need to start evaluating? Good question. And really the answer is it depends. So with data, really a datum, which is just a single unit of data, it could be anything. So it really depends on, it's a good idea to kind of plan ahead and scope out what you want to achieve with the evaluation. So for instance, if you want to say do an outcomes evaluation, because I know that quite well. So first you want to decide what outcomes you want to check, whether you want to do, say if you're doing something like from the comms, the NADA comms, which is the client outcomes measurement system. If you want to say look at psychological distress, which is indexed by the K10, which is like a 10-item scale that it basically, so someone answers and it indicates how psychologically distressed they are at that point in time. If you want to do that, then you just got to decide, like, do I want to check, say, for instance, how distressed someone is when they engage with the service versus when they disengage with the service. So the amount of data you need really depends on, once you've got an idea of what you want to check, then what you want to check or what you want to evaluate, then you can engage, say, an external evaluator or someone you're consulting with to conduct the evaluation. They can help you with like calculating things like, there's a concept called power in statistical analysis. All that means is that when we conduct a statistical analysis, we just want to make sure that when we conduct it, that the answer we get is going to be meaningful. So you want to collect enough data or have enough data available for, say, an outcomes measure like the K10, so that when you analyze it, it's actually going to tell you that there's a meaningful difference between intake versus when someone exits the program. So that really depends on what you're looking for. So I can't really give you a figure, but you're generally wanting to do, let's see, yeah, it really depends, but you want to make sure that there's enough data available. I think with most services, you probably would have enough data available if you're only using data from your own database. But generally, it's, you want probably over 100 like people participating. And then it might not even be your clients or people using your services that you're like their data being used in evaluation. If you're doing a process evaluation, it could be something like how many times this particular activity happens over time. So again, you want to kind of consult with your external evaluators or maybe a university contact to help you with that process of figuring out how many datums or how much data you need to have a meaningful result, because you don't want to get to the end of you don't want to get to the end of an evaluation and find out that you can't actually draw a conclusion from your findings because you didn't collect enough data. Okay, so I think that's all the questions that I have. So I want to thank everyone for attending today. I'm just going to go through and conclude. So for if you have any other questions or queries about this webinar today, feel free to contact Sianne, who she introduced herself before, our lovely Sianne. She's the program manager at NADA. And of course, you can contact me, and there are our emails on the screen and also our phone numbers. Now, next week, in the final part of the Better Practice series, I will be doing a webinar on benchmarking with the lovely Susie Hudson. So we hope you join us next week. Looking forward to it. I'd also like to just bring to your attention, if you're not aware already, I'm sure you are, the NADA conference is happening in April. So we'd love to see your faces there. And we're actually doing a hybrid format this year. So you can attend in person or virtually, which is very exciting. First time this has happened. So hope you can join us. And we've actually just released a new edition of the Advocate. So yeah, go onto the NADA website and check it out if you haven't got the email. It's a strengths-based approach is the current theme for the Advocate. And yeah, check it out because yeah, we really love this issue and we hope you enjoy it too. So thank you so much for joining us today, and I hope you have a wonderful rest of your week. Thank you.